Hey, Joe Jankowski, Senior Advisor with Henry Ford Innovations. Dr. Siegal, good to see you again.
Hey, good to see you, Joe.
You were in our inaugural class. Davidson is an experiential learning program that we created really in order to take our healthcare professionals as well as entrepreneurs now such as yourself and help them understand, especially in healthcare, how does one innovate, why is it important, and how does the theme of multidisciplinary contributions to innovation matter, and how does that come together? If you want to actually build a new product or service, what do you need to do? What do you need to be aware of in terms of regulation, in terms of where does venture capital come from, but also how do you create a network so that if you're going to go and do this and you're going to jump off the deep end, what sorts of support and contributions will you need from a community of innovators, whether they be people in your own company, your own corporation such as Henry Ford Health, or global?
Yeah, and this is so important because nobody teaches this stuff in medical school. Nobody teaches you the business of healthcare in residency. And so you either figure it out on your own or you go to a place like Davidson Fellowship where you can learn it in an environment that helps you figure out what you don't know. The most dangerous thing is to be in a situation where you don't know what you don't know, especially if you're starting a new business.
Yep.
And one of the things that I loved most about Davidson is it at least gave me a preview of all, well not all, but most of the roadblocks that I was destined to run into, and I guarantee you I ran into most of them.
You're gonna find uncertainty if you're an innovator. You're doing something by definition new.
Yeah.
As you know, and Scott Jankowski, our executive director at Innovation, started this program and went to the Davidson family, the foundation, to help us get this going. He was doing exactly what you said. Is he had at times suffered as a clinician wanting to improve things, but saying there's no support for us here, right?
Yeah.
And we need to really not only support our clinicians, clinical innovators, but also provide them resources. And that was really.
And there really are so many innovative-minded people within the health system, but they don't know that there's that broader network out there. And that was one of the most amazing things about the Davidson Fellowship. From the very beginning, brought together innovative, like-minded people from so many different backgrounds. I mean, I just remember being amazed that on my team alone, I was a physician, we had a nurse, we had an engineer from our corporate IT, and we had a graphic designer from the College of Creative Studies.
Oh, nice.
And the variety of opinion, not just on our team, but opinions from all the teams came together and really just provided an amazing medium for discussion. The varied backgrounds brought so much unique perspective on different ways to solve problems.
Yeah.
And really understand them at the level that you need in order to create the kinds of innovation that I think we've seen come out of the fellowship, which is really awesome.
Yeah, that's what I always enjoyed is you see, like you said, the breadth of talents, and for the first time a doctor would be like, oh, I know somebody from IT, not just as the guy who fixes my computer or helps me with Epic problems, but actually is there to say, oh, I can co-develop with you. And in fact, isn't that where you met Paul?
Yeah.
You started working together.
Yeah, he was on a different team, but we were working on similar ideas, had similar vision, and really started to coalesce towards the end of our fellowship. And then as soon as it was done, we realized we were on to something. That's when we started meeting up after work and really drawing some detailed sketches on the back of the napkin and trying to figure out how we would take it to the next step.
Yeah.
But it was the tools that we got from the fellowship that really informed how we were going to do those next steps.
Oh, that's great.
Yeah.
But yeah, I do remember, and I thought that was awesome because a lot of our fellows will graduate or finish the program in June and then say, well, what's next for me? And now we're kind of like, well, it's time to actually go off and apply these, in your daily practice. And you mentioned, the problem or the need, and it's interesting because in addition to multidisciplinarity, remember the second tenet was always need-based. And we say, forget solutions, right? Those are the easy part. Find a need. How do you define that need? What's really the pain point, right? What do we need to do better? And if you can focus on that, the elements of design come in, right? We're going to design a solution, which was always what was great when you mentioned you had the College for Creative student side, where you say, all right, it's a design process now. A lot of people will underestimate how much work it is. Like you said, nights and weekends. It had to be, 4 years before you probably, with some support of the hospital, before you actually, maybe for the first time, took the gloves off and used it what you had developed in the clinical setting?
Yeah, it was about 3 years, and many prototypes and lots of hours and sleepless nights and that sort of thing to get it to the point where it could even be trialed. But once that point was reached, it didn't stop.
Yeah.
There's more iteration, more learning, and just really continual focus on improvement and getting it better so that it can be used by more and more people. So how many alumni are there from Davidson at this point?
We're figuring there must be, almost probably a little shy of 200.
Yeah.
And that all stayed with the system, of course, with just work attrition and people moving, et cetera. But that's what's kind of neat is you probably have a community of at least 100 active Davidson fellows here who we always say they're almost our ambassadors, right? Because somebody in their department or at their hospital, if they're out at one of our campuses away from Henry Ford Health who are saying, well, I don't really know about this world of innovation or who can help, we all hope they go out, go to Henry Ford Innovations. We got this team and they're there to help, and by the way, they have this curriculum. And our largest class ever is going to be starting tomorrow. I think it's 37, which is crazy.
Wow. That's fantastic.
We used to hold it to about 20. And then we said, there's just too many people want in. And we try to look at their why they want to come in their narratives or where they're coming from. And we love this breadth of talents and of a diverse group in terms of age, race, gender, because we say you want a full spectrum of ideas. And we're like, how can we keep any of these out, right? So I went to Dr. D recently and was like, if we can fit them all in a room, can we take them? And they're like, yeah, let's do it.
Well, that's particularly important in the digital health age because the innovations and implementations of these things are happening so fast now.
Yeah.
Back in the day when you had to patent a device or a drug, it was a decade-long process before you could see even some laboratory results from preliminary ideas. And now apps and software and things like that can be assembled. I mean, it's still a long process, but way faster iterative cycle, way faster prototyping process, and in some ways more rewarding because you can start to see some impact much more quickly.
Well, as you know, we talk about adoption, and that's what's it was a double-edged sword because on one hand you can get things to the clinical environment faster and help people's lives sooner. The flip side is there's more noise in the system because it used to be, all right, I'm a surgeon or I'm an oncologist. I've had time to see in the literature that this drug's in development or this device is coming out. And I may have actually, had time to even read the articles. Well, now it's a company you've never heard of showing up at your door saying, we can solve this huge problem you have. But the problem is there's 70 companies showing up at your door saying that, and you say, well, this is a problem, but I don't have time to check everyone's out. So the better you can, recognize workflows, and the better you can have a multidisciplinary lens where you say it's not just that it works, but it has interoperability with your current system. It's affordable, it's secure. That you really start to put yourself in a position where that innovation can take root.
And that's one of the complexities of working in healthcare that I think a lot of physicians, again, I said they don't necessarily understand the business of healthcare. They don't realize all of the interconnections that are really required when it comes to security and compliance and how you interact with a big complex system like Henry Ford was really eye-opening to see and really important for anybody who wants to either work on these kinds of projects internally as an intrapreneur or externally and go out and start any kind of business that's going to be entrepreneurial. Really needs to understand that.
Yeah, I get a kick out of it because they'll say, like you said, iteration. So they'll talk to one doc and go, he loved it, he said he'd buy it. And we'll go, well, that's cool, but what do the other docs say? And I wonder, they say, oh, the docs like it. And I go, okay, but will the insurers say they'll pay for it? Or will the hospital administrator, the CIO is going to go, oh, we can never put that in running here. That'd be too high risk, right? And so you really do need that to almost force yourself to recognize that you need to check all those boxes or look under all those lenses, let alone patients, right? They have more power appropriately than ever. And as we empower our patients to make decisions, you're going to have to sort of, discover them as well. Or is this an intervention that they're going to be comfortable with? We've had several interventions now over the years make its way to the clinical environment here, right? Not all become companies. Some just say, hey, this is a better way we engage with our patients, or this is a way we now, as an insurer, help set up and recognize the need for incentives amongst our clients or our customers if you're an insurer. And we're looking forward to see how the needs coalesce into hopefully new solutions. And we're looking forward to see who the next Dan Siegal and our next entrepreneurs coming out of this cohort or. For you following us with Henry Ford Innovations, again, annual program, now we're going to be over 200 strong, and we will continue to affect the future of medicine by both creating a sense of community of innovators and giving them the training and the skills and the network they need to be successful.
I can't say, Joe, how important the Davidson Fellowship was to me, both from a motivation and a influential impact on why I became an entrepreneur. I would describe myself as an accidental entrepreneur.
There you go.
I knew I had interest in trying to help make healthcare better. I knew I had a background with certain technical skills, and I knew I could try to match that up with some of the clinical work I was doing. But I never, at the start of the course, in a million years, imagined that 5 years later we'd have a new company founded on the ideas that we generated during that fellowship. But I can't tell you how fun it has been taking everything that we have learned, and really, we have taken aspects from almost every single piece of that curriculum and applied it towards how we created an idea, how we generated support, how we started a new company, how we fundraised, how we built a team, how we navigated contracts and negotiations and legal and regulatory issues.
Yeah, all that stuff.
Sales, building out a team for how we would market the product that we now have in 8 hospitals. Again, I never could have imagined that this would have developed, and it's taken time, absolutely. And one of the things that I think you even mentioned in one of your lectures was that things take longer than you ever think it's going to take. Some things move fast, some things move slow, but I would say that learning has come from just about every single piece of that curriculum, and I really truly believe that anybody can be an entrepreneur. They just have to be in the right place at the right time with the right idea and then run with it. And Davidson really gives you all the tools to do that.
Excellent.
So I can't thank you enough for helping put that together.
Excellent.